Good afternoon, everyone. Hopefully you can hear me okay. This is Katie Cook from Adirondack Health Institute. Thank you for joining us, the North Country Telehealth Partnership, today on our webinar on school-based telemental health best practices and challenges. We are joined today by the team from Comprehensive Medicine. Comprehensive Medicine is a group that I came across about 2.5 years ago when I was working with Robert Klepping out in Hamilton County. And for those of you that are unfamiliar with Hamilton County, there's about a population of maybe 1,600 in the entire county. It is one of the only frontier designated counties east of the Mississippi River. So clearly access to specialty healthcare is a challenge in that region. And Bob was very innovative and forward thinking in how he wanted to bring some mental health services to his small county. And that's how we met Comprehensive Medicine. So if you could go to the next slide. Excellent. So our presenters today are Lisa Pappa, I hope I said that right. She's a psychiatric nurse practitioner who has over 17 years of experience working with children and adolescent youth in residential care, BOCE services, and outpatient. She has experience with trauma, substance abuse, and the spectrum of psychiatric illnesses. She will be our main presenter today. And then also joining us later on in the presentation for the Q&A portion is Dr. Chauhan. He's a child and adolescent psychiatrist and has over 10 years of experience working with children and adolescents with developmental disabilities, substance abuse, and various psychiatric illnesses. Just a few housekeeping items for everyone on the line. We will be recording this session, and the slide deck will be sent out along with the recording later this week. In addition, on your GoToWebinar dashboard, there should be a questions section. That is where you're going to want to submit any questions for the presenters throughout the session. We should have about 15 minutes at the end of the presentation to have the team from Comprehensive Medicine answer your questions. So please submit them through that box. If you would prefer to ask your question over the phone, please make sure that you put in your audio pin at some point and let me know through the question box that you would like to ask your questions verbally versus through the question box. At this point, I'm going to turn it over to the Comprehensive Medicine team to talk about school-based telemental health.
Good afternoon, everybody. Welcome to everybody joining us today. My name is Lisa Pappa, and I'll be sharing with you my experiences with school-based telemental health, and it's something I'm very passionate about. Our agenda will touch on background, statistics, benefits, and challenges of school-based telemental health. We are all aware that mental health is a critical part of development and overall well-being. We're living in the age of the brain, where advances in neuroimaging, brain mapping, and advances in technology has helped us to understand the relationship of the brain and the nervous system to the rest of the body, connecting physical and mental and social well-being. This growth has led to increased awareness and earlier recognition of mental illness. There are sobering statistics that show the increase in mental health conditions for children and adolescents in all age groups. To quote NAMI and CDC, in children ages 13 to 18, 21% of them struggle with mental health challenges. Homicide is the third leading cause of death in persons 10 to 24 years old. And added, suicide rates are the second leading cause of death in persons 10 to 34 years old. Suicide rates hit a 40-year all-time high in teen girls in 2015, as reported by the National Institutes of Mental Health. We are all aware and have seen the print and the headlines in our country related to the opioid epidemic. Daily, more than 115 people die after overdosing on opioids. There has been a dramatic rise in substance abuse and with more deadly consequences. More potent drugs, more potent drug combinations laced with man-made synthetic substances, and fentanyl that's 10 times more stronger than what's legally prescribed in pharmaceuticals. To quote ADA, the American Addiction Centers, they report 5.1 million young adults ages 18 to 25 have a substance abuse issue. More than 1 in 7 persons battles with substance abuse. The APA, the American Psychological Association, published an article in October of 2018 titled Generation Z. And the title of the article was Stress in America. It sampled 300 teenagers ages 15 to 17 and over 3,400 adults 18 years or older. It reported that individuals aged 15 to 21 reported the most mental health problems. I think to myself, it would be very nice to have programs for early intervention to prevent and lessen this statistic. Generation Z, the #1 stressor, was related to mass shootings and school shootings. #2 stressor was the rise in suicide rates, followed by the others that are listed on our screen. The culmination of all these social issues and of multitudes of others have led to the growth and promotion of telemental health. The main drivers are advancements in technology, lack of child and adolescent psychiatrists, which has been true for many, many years, and also the efficiency of school-based telemental health programs and the ways it increases accessibility to care. Support for school-based telemental health has grown and is becoming more common. In New York State, I was privy to sit on the Mental Hygiene Directors Board, which sought aggressively to have the regulations between multiple state agencies relaxed to allow for telepsychiatry, and they did so in record time. Many rural counties, with one I'm affiliated with, have set up telemental health services for their local school districts. Below is a statement from the APA and AACAP, public statements regarding the promotion of telepsych mental health services. And AACP is the Academy of American Academy of Children and Adolescent Psychiatry. Why school-based telemental health programs? The benefits of mental health has been shown. The need is there and the effectiveness is there. It reduces the barriers and increases access. When your child has suicidal thoughts, it's not the time to say, we'll have an appointment for you in 30, 60, or even 90 days. And I've seen this happen far too often. Emergency rooms are full, and they can leave people waiting for hours only to say, follow up with your primary care in the morning. Primary care offices are also overwhelmed with the mental health demands placed on their practices. Growing behavioral health needs of children and adolescents is relying on technology embedded programs in our schools to increase mental health. Some of the advantages include improved access to care. It's an efficient model which reduces overall healthcare costs. It is shown to have much lower no-show rates. Outpatient rates for no-show can be anywhere from 30% to 40, even 50% in some areas. I've had a 0 or 100% show rate in the schools that I serve, which is astounding. Other advantages, it's less travel time for providers. It reduces patient hospitalizations. Parents don't have to take time off of work, lose income, or possibly lose employment. Also, timely intervention helps identify youth at risk. Lastly, and really importantly, is it reduces the stigma of mental health care. We all know this age of growth and development with children and adolescents, everything is about what everyone thinks. Many teens and children that I have shared with me that they don't like going to the local mental health clinic or the psychiatrist's office. They've shared they don't want to be seen there by peers or labeled. And yes, unfortunately, the stigma still exists. I just wanted to note on the newest cover of People magazine, which came out in October this month, 2019, it has a picture of Michael Douglas and his son who's battled substance abuse and been in prison. And on the inside cover, the editors noted that they're dedicating the next year in highlighting mental health and partially to help reduce the stigma. Moving on now to talk about a little bit about the how-to and best practices. The hybrid model is the model of care shown to be most effective and advantageous at reducing illness and improving quality of care. It combines a combination of telepsychiatry visits and in-person visits. In-person visits help to build the human interaction, helps you to observe body language, and is more personal. It helps to build strong relationships with the school-based staff. It helps to understand the school's culture, the expectation of students, classroom etiquette, and understanding school policies and operations. In-person time has worked out great for me as a provider. In doing classroom observations, watching peer interactions, watching patients' social skills and engagement are all very helpful to me as a provider in identifying appropriate therapy and even pharmacological treatments. In addition to providing time for in-person observations, there's also times we set aside for team consults, doing rounds, updates on children as to any changes, medication efficacy, and other topics are very helpful. It is helpful to be involved in the IEP process, adding insight into behavioral plans, and having provider input related to the DSM-5 diagnostics and pharmacological interventions with each child. Pharmacology remains a very big area of my input. I provide detailed education to the staff, the families, and the children on the medications that they take. The intention of the med, the action of the med, and our desired outcome for the med are very, very important. And always, always, always sharing and increasing knowledge in the side effect profiles. I believe it's very important to the trusting relationship to be honest and transparent about medications. And I take it very seriously when prescribing to minors. What to look for, I also cover. The more serious things such as EPS, which is extrapyramidal symptoms, and tardive dyskinesia, which is TD, also neuroleptic malignant syndrome and serotonin syndrome. Those are all very serious conditions that can occur with the use of psychiatric medications. I also always like to share that all medications have risks, and it's important to give people the risk and the benefits to help them make healthy choices for themselves and their children. And now I'm going to hand the floor over to Anu Tanwar, who's going to discuss the logistics of setting up telemental health and telepsychiatry platforms.
Thank you, Lisa. Good afternoon, everyone. I am Anu Tanwar. I am the Telemedicine Program Coordinator for Comprehensive Medicine. I would like to share some unique considerations for setting up and providing mental health care in schools. School telemental health services are delivered over secure, HIPAA-compliant technologies with the mental health practitioner in one location, and the patient often accompanied by a school-based professional located at the school. It's very important that we establish really high-speed, good internet connectivity, preferably an Ethernet connection. That's what we do with our clients as we're setting up our offices on the provider side and at the client side at the schools. Very important that before, prior to going live with the telemedicine program, testing and training of the practitioners and school staff should be done. And as I said, practitioner and school they should provide a secure network connection, so both parties are responsible for troubleshooting technical problems at their own ends. Also, providing training to practitioners on the electronic health record system and applicable school policies and procedures is very important. And in order to optimize engagement and focus during a session, mental health practitioners should consider telepsychiatry etiquette when interacting with the patient, family, and school personnel, such as exaggerating facial expressiveness, approximating eye contact, and modulating the rate and tone of their voices. Just helps with engagement and focus, especially when you're working with children and young population. it is very important that practitioner and school identify one staff member on both ends, like a dedicated contact, a dedicated person who is responsible for scheduling, facilitating communication between parents, school professionals, and providers. So this role, the dedicated person's role is to be able to set up the equipment, set up training for the school-based professionals, connect the providers to the patient, and help guide children and families through the sessions. In order to avoid disruption to patient care, it is very important to have timely communication of any changes in personnel or system status between the two sides. And now I'd like to give little bit information on how to set up telemedicine rooms. It is very important to have a dedicated room at the school to conduct telemental health sessions. The telemedicine room should be in a quiet location to minimize exposure to noise. Rooms with good lighting and without windows are better for quality imaging. Rooms should be sound masked to ensure security for privacy. Practitioners and school-based facilitators need to take extra precaution to ensure privacy of the treatment rooms. And practitioners should be provided a room phone number and contact to call in an event of technical difficulty while the session is going on. And from the provider side, definitely ensure the clinic is HIPAA compliant. It promotes professionalism and confidentiality at all times while providing telemedicine services. And again, same thing, should have a provider as well, should have a telemedicine room phone number in case there's a technical difficulty during the clinic hours. And now I'm gonna hand it over to Lisa to talk about the challenges in a school-based mental health program.
So lastly, some challenges. Setting up linkage and connection to community resources can be trying. Mainly based on what's available in your area, and some of the specialties might be very far from the families. Some examples of linkage is substance abuse programs, specialized therapy programs like DBT, CBT, which is dialectical behavioral therapy and cognitive behavioral therapy, and trauma-focused cognitive behavioral therapy, often groups that focus on grief and loss for children, and anger management programs. Also setting up relationships with local specialty doctors, neurologists, and primary care offices can be challenging, but it's really essential in establishing a good network of care for children. Also helping parents and caregivers accept this new technology. Not everybody is screen savvy. I've had many grandparents who really think it's kind of weird and way out, but I find that the risks, the benefit of being able to have their child seen far outweighs their uncomfortableness with technology. Also maintaining privacy on site, which Anu has already discussed, having a secure room with little distractions, good lighting and good audio are essential, and preparing participants as far as what to do in case of an emergency, and that includes having staff on hand. Not every visit goes perfect, and you have to have a plan if that doesn't happen. But in conclusion, I just want to leave with you that I believe that telepsychiatry holds the promise to reach the unreachable. Most important, our most valuable resource, our children, is who really is the future. Research and supports the effectiveness of telemental health. Our kids need the help. I feel mental health education should start in preschool all the way into adulthood. Children need to develop strong skills for strong minds and to build resiliency. Mindfulness, stress relief, problem solving, and developing a toolbox of coping strategies is essential to the success of our children. I want to thank you all for listening and for your patience with our presentation. Now we'll open it up to any questions.
All right, thank you very much to the both of you for that presentation. I do have Dr. Chauhan unmuted as well to help with questions. So please submit your questions through the question box. We have received a couple of questions, so I'm going to go ahead and ask those one by one. So the first question was, in New York State, do the schools need to meet any specific requirements to provide school-based telehealth programs?
Hello, everyone.
Hello.
Can you guys hear me?
Yes.
Okay. Let me introduce myself. Good afternoon, everyone. This is Dr. Smit Chauhan. I'm a child and adolescent psychiatrist. I work with comprehensive medicine for a long time, and I just wanted to open, questions for me if you guys have. I think the best person to answer this question would be Anuradha. Anu, if you can answer specifically the questions regarding the requirements for telemental health in New York.
New York. Currently, I mean, I can get back to you and do a little more research around it, but schools are under FERPA regulations. So as long as they really don't come under, well, it depends. I mean, depends on different facilities, but the ones we are working with are not under OMH or DOH, so those regulations don't apply. And we are basically working with BOCES, a Board of Cooperative Education Services. So I think I'm going to have to get back to you specifically on the schools, but as far as I know, they come under FERPA and they are not under OMH or DOH. But definitely let me research and get back to you, Katie, so we can forward that answer over to the person who's asking.
Correct. And to my knowledge, I am not aware of any specific requirements for schools, but whatever you find, we'll share with the group.
Sounds good.
Hey, let me add my experience. In my experience, I don't think there is any specific requirement that is needed, as long as there is an agreement between a provider, which can be a psychiatrist, nurse practitioners, or a group or a contract group, and as long as there is agreement between how the patients or the children or students are going to be evaluated, and how now you have to understand that because these are children, we will need or a psychiatrist will need consent and permission from the parents or the legal guardians to conduct an interview and provide assessment and treatment. And there are chances, most often than not, where parent might be or the guardian might be invited in for a in-person visit when the patient is being seen on the school site or through telemedicine. So, but not necessarily any specific requirement in particular, which is regulated by a law, to my knowledge.
And that actually segues nicely into the next question that came up, was how do you handle the consent process for children under 17?
Sure. So because these are minor children, in case there can be a high schooler that can be older than 18 years of age, or individuals or minors who are deemed to be to be able to provide minor consent, those minors can provide consent themselves. Otherwise, we will need a consent for evaluation for every child or student from their legal guardian or their parents or whosoever has the legal authority. And ideally, we would like to have them present for the initial interview, so that we can get a clear picture of how they are performing in the home setting, as well as outside of school. We do have the luxury of getting information from the teachers and the guidance counselors and other school staff who provide a report about the direct observation and patient's behavior. But the consenting parent or guardian is very important in that. And actually, to be more elaborate, they would need to provide us consent, or we would need to get consent for conducting an interview, as well as discussing diagnosis and treatment.
Okay, thank you. The next question is, does the initial visit have to be face-to-face?
Not necessarily. There used to be, this is a very good question. This used to be an issue in providing services a few years ago, but for the last 2 or 3 years, there have been amendments being made. There have been amendments being made so that telemedicine services can be provided, especially in the field of psychiatry, dermatology, neurology, where patients can be evaluated via telemedicine, as long as there is a qualified person doing a face-to-face evaluation on the patient side. That means a nurse or a nursing assistant should suffice, where they have some medical knowledge and they can provide some objective evaluation if needed.
Okay. Next question is, do you know of other programs like this that exist in New York State? And if so, how are they different from your model?
Go ahead.
Let me share my experience, and I think Anuradha can probably elaborate this. This model has been very commonly practiced in several states in the country. And so New York is not the only state where this is being practiced. In New York State, there are several counties that have contracted with individuals, psychiatrists, child psychiatrists, or an organization that provides services like how we provide. Now, the difference is what they provide differently, in my experience, could be that they can be individual providers who can be available to provide services in person or via telemedicine. We are a group of providers where we have more than one providers available, and that is the difference between us. Now, we may use a different software, we may use a different telemedicine HIPAA compliant model, which may differ. Our prescriptions, providers may differ, which is usually linked with their electronic health records, but necessarily the quality should be the same.
Okay.
Anuradha, you want to elaborate on that?
No, I think you've covered it. Covered everything, Dr. Chauhan. The only I know that NYU is serving one of the BOCES in our area. So definitely institutions like Columbia, NYU has started to, in addition to comprehensive medicine, providing school telemental health programs. But I'm not aware of any other company or practice doing that in a more elaborative fashion. But I think you covered it as far as individual providers have started to as well. So.
Okay, thanks.
All right, next question. How is the provider reimbursed for teen consults and classroom observations? I am not aware of those being billable for MCOs and Medicaid.
Well, so if there is a provider on site, they can perform school observations, and I'm not sure about the details about the Medicaid, whether they are being reimbursed or not, but if I am providing services to my patient, I would club those evaluations into my billing codes. Now, this is based on if we are billing it to their insurances, but in majority of instances, I think the contracting, it depends upon how the contract is being made. If the contract is made with BOCES or if the contract is made with an individual school, I think overall, the time may be lumped together depending upon the agreement, is what my understanding is.
Okay, thank you. Any other thoughts on that from the other presenters?
Yes, it's not a traditional model as like outpatient where you're dealing with insurances.
Yeah, that's exactly what my understanding is. that this is a different setting, and I think this is a specialty service that is provided to the school, and the school has the benefit. In few of the states, the school there have been laws passed to improvise on mental health systems of care for the students of that particular school district, so I think this is a different model where we do not have to interact with their insurances, particularly because the services are provided at the school site through the school resources.
Okay. Moving on. Do you have any experience with clients or patients that may need to be seen for a crisis visit on days or times that the school-based clinic program is not open? If so, this means that the clinic therapist would not be on site. Would you then have a school staff facilitate the appointment, or would this not be pursued and is an appropriate use of telemental health?
Very important and a very good question. Well, after school hours, we are available by phone regarding if there are any issues regarding medication services. Regarding any particular emergencies, I think that has to be handled as if it is an emergency, and we would advise the patient or the families to call 911 and do the needy or take them to the nearest emergency room, because this is an emergency which cannot be handled by telemedicine services, because majority of the instances there are safety concerns, and the safety concerns can be addressed only in person at the specific locations, which can include emergency room settings as well as the crisis centers at Office of Mental Health in every county.
Right, and I would agree with everything Dr. Chauhan said, and also that it's not like a 24-hour service where you're on call 24 hours, and so anything that would happen outside of that was an emergency would be handled as a normal psychiatric emergency would be.
Okay, thank you. So in terms of reimbursement, do you charge by the hour, or are you billing insurance for the telehealth visit? Who pays and how much? And are value-based contracts going to provide motivation to adopt this?
Now, this is a question that can be discussed by Anu. When the contracts are being made, the contracts can be made depending upon what the agreement is by the service providing party, which would be us, and the service receiving party, which can be the school. Now, we are absolutely not billing anything to their insurances because that is not a part of the service agreement. Because we are utilizing school setup, we are utilizing school resources, it is a separate agreement between the schools or the school district or the school system in particular, wherever the agreeable party and the agreeable service provider, which would be us, get into agreement. So it's a specific question depending upon what the agreement is. It can be per hour, it can be based on the time, it can be based on the patient, but I think whatever the agreement can be made.
And I'll add to that like Dr. Chauhan said, that every school or education institution, it all depends of their needs. So if depending on what their requirements are, what their needs are, some are needing only psychiatric care services, but some are also needing therapy, education for their staff. So it all depends on particular need of the institution, and that's how basically every contract is or agreement is being formed.
Okay, thank you. The next question goes back to consent, and it's just more specific. When a child is identified as a candidate for a virtual visit, are the parents contacted via phone and verbal consent is received? If not, if you're using paper consent, does the school handle that and fax that over to you?
We send out a packet which includes all of our consents, welcome letter to the program, and it outlines a lot of things. So we require the written consent up front before the first visit is scheduled with the child.
Okay, thank you.
And I would also want to add to it that we would also be requesting the guardian or the parent to be physically present at the first appointment, so that everything can be discussed in person at the first appointment about the goals, expectations, plans, and the way the treatment will be performed. And if a medication is supposed to be started, we will also go over in detail with the family about how we will be routing the prescriptions, and we will be handling that.
Okay, thank you. Next question is, are any of your telemental health providers LMSWs or LMHCs for therapy?
Can you repeat that question again, please?
Are any of your telemental health providers from Comprehensive Medicine licensed master social workers or licensed mental health clinicians for therapy?
Well, very good question. Number one, I'm a child and adolescent psychiatrist, board certified. I have the license to practice medicine as well as provide individual psychotherapy. There are several different models of psychotherapy that I'm an expert in and often provide this on a regular basis. So depending upon the contract, depending upon the agreement, depending upon the specific need of the child or the patient, I would be able to provide it as and when needed. Now, the nurse practitioners that work with us also have the ability to provide all of that. Anuradha, you want to add?
Yeah, and I would add to that again, as you said, Dr. Chauhan, depending on the need of the facility, agency, institution, and if they are needing, in addition to child psychiatrists, psychiatric nurse practitioners, if they're needing social workers, yes, we do have access to those providers. And again, depends on the need of the facility, and we do want to be able to provide a comprehensive solution to what the need of the institution is. So yes, we can provide those services if the need is there.
Okay. The next question is, how do you manage strict firewalls in school districts that often change? That has been a barrier that I've even seen myself in the past for school-based telemental health, and using a cloud-based system has been helpful.
Sure.
Can you please repeat the question again? I'm sorry, it got some connection problems.
Sure. How do you manage the strict firewalls in school districts that often change? That has been a barrier sometimes in school-based telemental health, and using a cloud-based system has been helpful.
Sure.
Yes,
I can take that question. Okay, go ahead. Sorry,
sure.
Dr.
In my experience, yes, I have experienced that the school-based firewalls are very stricter. But I think it's our IT department that kind of works with the school system to kind of make changes in our firewall as well as the school system's firewall to accommodate that. And I have experienced this in a couple of places where there were issues, but we were able to resolve it. Anuradha, you want to add?
Yes, absolutely. So when we implement our telemedicine program in a school setting or BOCES setting, we work extensively, very, very closely with the IT department of that particular institution. So our IT folks work very closely with their IT folks, and our telemedicine platform, which is cloud-based. So they do give us access within their firewall. So to answer, basically, you just have to very collaboratively, team-based approach, work closely with the IT groups of these, of your clients. And we haven't had any issues after the program has been implemented, tested. So it's not been a big issue for us so far, right, Lisa?
Yeah, absolutely.
Okay, The next question is, how is medical information like weight and blood pressure obtained from students enrolled in school-based mental health clinics that receive telemental health?
There's
So the good question, because we when we perform an evaluation or provide treatment, the vital signs, which includes temperature, blood pressure, heart rate, respiratory rate, are very important, and we also calculate BMI, are very important during the provision of services. So depending upon the agreement with the school system, maybe we can have, there is a possibility we can have the school nurse or the school certified nurse assistants can provide all of that information, which we will enter in our system, or depending upon the agreement, you know, we may be able to provide a medical assistance in that regard as well. Anu, you want to add?
Yep, no, Lisa is going to add.
And for me, in my experience, I send over a template for each student, and we do heights, weights, and blood pressures as routinely as I need them and it is warranted. But also the therapist that comes with the children has been very instrumental, and a few times I needed I'd send over an order, they would make sure it got to where it needed to go. So the school staff is also instrumental in helping us with that. But every school does have a school nurse, and that's who really helps us with the vital signs.
Excellent, thank you. Next question. Just real quick, whoever's typing, if you could just subside, it's just so everyone can hear us. Do you have a sample workflow chart that could be beneficial to schools that are new at offering this type of program?
We could create one. We haven't, yeah, we could create one for you guys.
Yeah, when you have that created, certainly send that to me and I can share that with this group.
Sure.
Next up, what HIPAA compliant platform do you use?
We use Zoom, but we're also developing our own application, again, using Zoom as a backend. Because in a school-based setting, so we started using Zoom at federally qualified health centers and other institutions, but when really got introduced to the school-based setting, again, it's amazing to me, the whole, the team-based approach, the collaborative care approach, it's just needing a little bit more than just the telemedicine platform. I mean, we need to be able to share different documents, and we can't really give them access to our EMR. So we do need a solution where you know, they are able to send us files that our providers can review. They're, you know, we're able to schedule properly, because scheduling is definitely a very big part of this whole success of this whole program. Working very closely with the you know, the scheduler on the other side and our side. So long story short, we use Zoom at this time. We have developed our own application, which encompasses scheduling, booking, attaching files, of course, the video component of it. And we do want to put some simple EMR in our application. But Zoom will always be our back-end video conferencing application.
Okay, thank you. Next question. Have you ever utilized telemental health services to see a child in the home in the scenario that they are not attending school to have their behavioral health appointment? Do you utilize direct-to-consumer telemedicine to try and evaluate them in their home?
Not yet.
The answer is yes.
Oh,
The answer is yes.
But, in New York, we have not, but in California, yes, sorry about that.
No, the answer is yes, because that is how we have done it with our patients, where we bill the patient's insurances, but we have not been able to do it with these contracts, because the contracts we have an agreement that the patient will be presented at the school setting, at the school clinic. You know, so two different things, but I want to clarify that that has been done, but that's a part of the private practice. And
so I just want this group to know that comprehensive medicine is in the state of New York and state of California. So Dr. Smit Chauhan, of course, is licensed both in the state of New York and state of California. But in California, we have launched the direct-to-consumer model, whereas in the state of New York, we are still working only with institutions. And as Dr. Chauhan said, that when your contract is with the school, so we really have not seen any kids in their home settings, but because we just want to, I mean, our agreement is to be able to provide services in a school setting, and that's what we do in New York.
Okay, thank you. Have there been any issues regarding insurance companies covering telemental health? And if so, how have they been faced?
Well, depending upon what setting we are providing services. So if it's a private practice model or consumer-based model, majority of insurances are providing equal amount of service provisions and access. Some of the insurance would require a prior authorization or prior approval to provide those services. But in the school setting, we actually do not have to negotiate or deal with the insurance companies in that setup. It's just directly between the schools, which are the receiving parties, and the providers, which is us. So it's based on the direct agreement between us.
All right, thank you. Next question, what observed outcomes have you captured in regards to students' performance, family relationships, etc.? What is the school's response when students are pulled out of their classrooms, considering the amount of time needed for each appointment?
Well, the reality is it's based on the individual student's needs. And if the individual student or child is experiencing any of psychiatric issues, I think in my experience, the schools are very much happy and welcome the idea of getting them evaluated, because the identified problems, the problems can be identified and that can be addressed. Whether the problems may be a family issue at home, relationship issue at home, conflict with parents or guardians, which may be affecting their performance at school, I think it can be addressed readily. And our experience has been very positive from the school systems. Now, we usually let the school to decide the schedule. So I think the school has the liberty to, depending upon the time frames that has been agreed, it's usually the school that does the scheduling based on the recess times, or based on lunch time or after school time, where the patients can be scheduled. Has that been the case, Anuradha?
Yeah. And Lisa is gonna.
And just to add to my experience, I have found that the feedback that I've gotten from parents is many times, especially in the rural area, there'll be a catchment, a county clinic, which handles all the mental health needs, and there's not much else. And I found the feedback that I get from parents are they feel like their visits are that we're listening to them more, that they're more comprehensive, and they don't feel like they're just a number and being rushed out, and they just feel like they're more comprehensive. So I've had really good feedback. And as far as to answer the caller's question, as far as the children, I have not yet once, and I am surprised about it, had a kid refuse to come and sit for the telepsych. So they do try to find opportune times, like in between their classes, and to take breaks, but the kids are very energetic and have been 100% participatory.
And I just want to add something. In my experience, I think I've heard from parents who are extremely grateful for the services that are being provided at school, because on the other hand, it can be very challenging to find a child psychiatrist in an area where there may not be one available, or there may be one available, but the appointment may be 2 or 3 months from the current date where the need is. And what I have seen is the telemental health services being provided at school are just readily accessible, readily available, and the school can do the triage about who needs the services more or earlier than and can accordingly manage our schedule.
Okay, we have 2 more questions. Do you work with preschool children?
I do.
Yeah.
I do. Depends upon the contracts. Depends upon which school you are contracting with. Preschool children come up with a different set of symptomatology and issues and problems. Middle school and high schools have different needs and presenting symptoms. So in my experience, depending upon where we have contracted with, we provide services to patients of different ages.
Yep, and I was just going to add to that we do have a BOCES here in New York that Comprehensive Medicine is serving. They have a Spark program, which is for younger kids. It's like a 90-day program, and they just come there for evaluation. So yeah, so one of our psychiatric nurse practitioners is working in that program, but it's more on site, just because they're so tiny at that age. So it's a combination of tele and on-site.
Okay, thank you. Last question. Do your providers have access to the student's electronic health record? And if so, where is the telehealth visit summary documented?
The telehealth summary visit is documented in our electronic medical records that we use. But it can easily be accessible by requesting the documents from the parents or from the school. But yes, we do have access to their health records, which is requested at the time of initial appointment. And I think all the information is provided in the information packet that goes out, where informed consent is being secured or provided by the parents or guardians, where it is expected that they will provide us with all the health records, which will be documented in our system, and our records can also be accessed upon request.
Okay, that is the last question that came through. So I will wrap it up at this point. I want to thank the Comprehensive Medicine team for taking the time to spend with all of us today. Again, the slide deck and recording will be sent out later this week, along with the contact information for the presenters today. So thank you for sharing your afternoon with us. We'll be sending out information on our next webinar series later this week, which will be around reimbursement and operationalizing telemedicine programs. From the North Country Telehealth Partnership, have a great day. Thank you.
Thank you.
Thank you.
Thank you, everyone.